Many older adults believe that certain discomfort when urinating is normal with age, but it's not. If you notice changes when you go to the bathroom, pain, urgency, foamy urine, or any unusual symptom, your body is trying to tell you something important. In this video, we're going to discuss 7 signs you should never ignore when you urinate. Each one can be the first clue of a condition requiring urgent medical attention, from infections and kidney stones to more serious bladder or kidney problems. I know talking about this is uncomfortable, but knowing these warnings can make the difference between an early diagnosis and complications that impact your health and quality of life. Keep an open mind and pay attention to every detail. It's not just about fixing a passing symptom. It's about listening to what your body is telling you and acting in time. Before we continue, I'd like to know, how old are you and where are you watching from? Leave it in the comments. I'd love to learn your story and your city so we can connect with everyone tuning in. Now, let's go over the first sign you should never overlook. Pain or a burning sensation when urinating should never be considered normal, regardless of age. Many people chalk it up to dryness in older years or not drinking enough water. However, this symptom is often the first alert of a urinary tract infection, kidney stones, or even prostate problems that require immediate attention. Why does it hurt or burn? As urine passes through the urethra, its delicate, sensitive tissues become irritated if bacteria or rough particles are present. In a urinary infection, for example, the bladder and urethra become inflamed. Each drop of urine rubs against inflamed tissue and causes that stinging sensation. In the case of kidney stones, small stones or crystals travel down the urinary tract, scratching the walls and triggering painful spasms that can radiate to the lower back. Urinary tract infection, cystitis or urethritis. It's more common in women, but older men can suffer from it when an enlarged prostate partially blocks urine flow. Symptoms include intense burning at the beginning and end of urination, an urgent need to go even if only a little urine comes out, and persistent discomfort in the lower abdomen. Without treatment, a simple infection can ascend to the kidneys, pyelonephritis, causing high fever, chills, and lower back pain. Kidney stones. These mineral deposits vary in size. A small stone may pass almost painlessly, while one larger than a few millimeters scrapes violently against the urinary tract walls. The intense pain, often described as a renal colic, may be accompanied by nausea and sweating. If you notice these signs, imaging, ultrasound or CT scan, and a urine analysis are essential to confirm the diagnosis and plan treatment. Prostate problems. In men over 50, benign prostate enlargement compresses the urethra, making it hard to empty the bladder completely and causing burning when the bladder contracts forcefully to expel urine against the narrowed passage. What to do if you have pain or burning when you urinate? Do not ignore it. Even if it subsides by the next day, inflammation may have progressed. Stay hydrated. Drink plenty of water to dilute urine and flush out bacteria or crystals. See your doctor. A simple urine analysis can detect infections, hidden blood, or proteins. Avoid extreme home remedies. Don't take antibiotics without prescription or strong diuretics without medical advice. Record your symptoms. Note the intensity, duration, and frequency of pain to help your doctor diagnose. Listening to your body is the first step to protecting your kidney and urinary health. If you feel burning or pain, act quickly. Early treatment will prevent serious complications and restore your peace of mind. Feeling like you can't hold your urine is more than an annoyance. It can signal that something isn't working properly in your body. As we age, going to the bathroom regularly is normal, but there's a thin line between normal and excessive. Crossing it may point to anything from blood sugar imbalance to a neurological issue affecting bladder control. What does "can't hold it" mean? That intense urge, the sensation that your bladder could burst at any moment, isn't just urgency. Your urinary system should let you reach a restroom safely. When the reflex to urinate is triggered too quickly, we call it urgency. If you experience this urgency many times a day, it becomes excessive frequency. Normal versus excessive frequency. Normal urination. For an adult, urinating 4 to 6 times during the day and once at night is considered healthy. Excessive urination, more than 8 or 9 times daily, or waking up multiple nights in a row with an urgent need to go. Remember that this varies with fluid intake, medications, and underlying conditions. However, if you notice a sudden change in your routine, don't blame it solely on coffee or cold water. It could hide a deeper disorder. Links to other conditions. Type 2 diabetes. In diabetes, excess blood sugar forces the kidneys to filter more fluid to eliminate glucose, resulting in increased urination frequency, polyuria, and constant thirst, polydipsia. Excessive urination often appears before a diabetes diagnosis. Overactive bladder. This is caused by involuntary contractions of the bladder muscle, detrusor. These contractions trigger a sudden urge even when the bladder isn't full and may come with incontinence, worsening the feeling of loss of control. A real-life example. I met Mrs. Amalia, 74 years old, who attributed her new urge to urinate to drinking more water after a throat infection. "I thought it was normal," she told me. "My doctor told me to stay hydrated, so I upped my tea and water intake. Then I started waking up 3 or 4 times at night. I blamed the tea, until one day I woke with a fever and headache. I went to the doctor and was diagnosed with type 2 diabetes." Her story shows that ignoring urinary frequency can delay a vital diagnosis. What to do if you suffer urgency or excessive frequency? Keep a record of how often you urinate and how much water or caffeinated beverages you drink. See your doctor if a sudden change persists for more than a few days. Manage your diet. Cut back on coffee, alcohol, and citrus, which can irritate the bladder. Train your bladder. Try to delay urination by a few minutes to gradually increase bladder capacity. Don't minimize urgency or frequency. Heeding these signals in time can help you detect diabetes, overactive bladder, or other conditions before major complications arise. Seeing blood when you urinate, even in small amounts or as a dark red streak, is never normal. Some people attribute it to irritation or something they ate with red dye. Others think it'll pass and wait it out. But hematuria, blood in the urine, is a red flag that demands immediate medical evaluation. Possible causes: urinary tract infections. Severe bladder infections can cause inflamed bladder walls to bleed, often with pain, urgency, and burning. Kidney stones. Sharp stones scraping the ureters cause hematuria and severe flank or lower back pain. Prostate disease. In men over 50, benign prostate enlargement can cause small bleeds by damaging vessels around the urethra. Bladder or kidney cancer. Although less common, blood in the urine can be the first sign of a malignant tumor. Early detection greatly improves treatment success. Kidney disease. Glomerulonephritis and other glomerular diseases can manifest with hematuria, ankle swelling, and high blood pressure. Common myths. It's just exercise irritation. Long runs or jarring movements can cause microtrauma, but hematuria without intense effort that persists is not normal. It's what I ate. Beets or food dyes may color urine, but that tint fades when diluted. Blood retains its color even after you agitate the sample. It doesn't hurt much, so it's not serious. Mild pain or no pain does not rule out internal damage. Many early cancers cause no discomfort. Recommended tests: complete urine analysis to detect red blood cells, proteins, bacteria, and inflammation markers. Urine culture to identify bacterial infection and the most effective antibiotic. Renal and bladder ultrasound to visualize stones, malformations, tumors, and blockages. Cystoscopy, using a small camera through the urethra to directly examine the bladder and urethra. Kidney function tests, glomerular filtration rate, and blood creatinine, and urea levels to assess kidney health. Act quickly. If you find blood in your urine, don't wait for it to go away on its own or rely on home remedies without a diagnosis. Contact a urologist or your primary care doctor immediately. The sooner the cause is identified, the more treatment options you'll have, and the lower your risk of serious complications. You may have noticed foamy urine and dismissed it as urinating fast or soap residue in the bowl. However, when foam persists and doesn't disappear after swishing the water, it can signal excessive protein loss in the urine, indicating that your kidneys aren't filtering properly. What does persistent foam indicate? Normal urine contains minimal proteins, too little to create foam. When you see a dense layer of bubbles that lingers, it's likely due to abnormal protein, especially albumin, in the urine. This is called proteinuria, and it often appears before other kidney disease symptoms. Connection to chronic kidney disease. Chronic kidney disease involves the gradual loss of glomerular filtration function. When the tiny capillary networks in your kidneys are damaged, they allow albumin and other proteins to leak from the bloodstream into the urine. Over time, this protein loss and reduced filtration capacity lead to fluid retention and swelling in the legs, ankles, or eyelids, edema. High blood pressure, as damaged kidneys can't regulate it properly. Fatigue and weakness, because protein loss reduces the energy available to your body. Detecting proteinuria early is crucial to slow the progression of kidney disease and preserve kidney function as much as possible. Don't dismiss weird but painless symptoms. It's easy to ignore foamy urine since it doesn't hurt or cause urgency. Some attribute it to fast urination or soap residue. But if you consistently return from the bathroom with bubbly urine, your body is sending a clear message. Your kidneys aren't working well. How to check this symptom properly? Inspect a clean toilet bowl. Ensure no soap, detergent, or cleaners remain. Collect a sample in a transparent container. Catch a bit of urine in a clean plastic cup. Gently swirl the sample. If foam stays for more than 30 seconds, it's a sign of proteinuria. Record when and how often it appears. Keep a log of days and times when foam is present. Recommended tests. Urine dipstick test to quickly detect albumin. Urine albumin to creatinine ratio to measure precise protein levels. Blood tests to evaluate kidney function through creatinine levels and glomerular filtration rate. If you confirm proteinuria, it's essential to consult a nephrologist. With timely treatment, blood pressure control, a protein-restricted diet, and kidney protective medications, you can delay the progression of kidney disease. Noticing foamy urine could save you from future complications. Don't wait for painful symptoms to appear. Prevention starts by paying attention to what your body reveals in silence. Your urine is like a mirror reflecting your internal health. Changes in its color or smell can reveal anything from simple dehydration to serious liver or metabolic problems. Knowing what these changes mean will help you decide when to worry and when to simply adjust your habits. Very dark yellow urine often signals dehydration, but it can also indicate bilirubin buildup when the liver or bile ducts aren't working properly. If your urine remains almost amber for more than a day, especially alongside yellowed skin or intense fatigue, you should seek medical advice. A reddish or pinkish tint may come from foods like beets or cranberries, but true blood in the urine stays red even when you dilute the sample. A persistent pink hue demands a urine test and culture to rule out infection, stones, or tumors. Brown or tea-colored urine suggests bilirubin or myoglobin in your urine, common when red blood cells break down, hemolysis, or in advanced liver disease. It can also occur after extremely intense exercise, but if you haven't been pushing yourself that hard, see a doctor right away. Strong, pungent urine odor can result from bacteria like Proteus mirabilis producing ammonia. If your urine continually smells like ammonia, you may have a urinary tract infection or an elevated urine pH. A sweet or fruity odor is a sign of ketones in the urine, typically in uncontrolled diabetes mellitus. If you notice a sugary aroma, your body may be burning too much fat and producing ketone bodies, an urgent sign to adjust your treatment. A metallic smell can arise from excreting certain medications or from iron supplements. But if you're not taking those and the odor persists, it could indicate toxin buildup from kidney failure. How do you tell food effects from medical alerts? Keep a food log. Note what you eat before changes occur. Foods like beets, asparagus, or dyes can color your urine, but that effect usually fades within a day or two. Watch for persistence. If abnormal color or odor lasts 3 days in a row without a change in diet, there's likely an underlying cause. Look for other symptoms. Fever, pain, leg swelling, unusual fatigue, or jaundice are clues that it's not just your diet. When is it urgent, and when can you watch and wait? Urgent. Tea-colored urine without intense exercise. Persistent sweet odor with excessive thirst. Very dark yellow urine with jaundice or abdominal pain. Constant reddish urine without eating beets or other color-rich foods. Watch and wait. Slightly darker yellow urine after days of low fluid intake. 1-day odor change after coffee or strong spices. Pinkish tint after eating beets or berries, resolving the next day. A little dribble or leakage when you cough, laugh, or lift something heavy can seem minor, but if it happens often, it signals that something is off in your urinary system. When is leakage normal, and when isn't it? Normal. An occasional drip right after you finish peeing can happen because a few drops remain in the urethra. You can usually fix it by gently tapping the base of the penis or pressing the perineum before standing up. Not normal. Leaks when you cough, sneeze, lift weight, or even take a step indicate stress incontinence. If you feel such an intense urge that you can't reach the toilet in time, that's urge incontinence. Common causes include pelvic floor muscle weakness. These muscles that support your bladder and control flow can weaken with age, giving way under abdominal pressure. Neurological issues, conditions like diabetes or spinal cord injuries, can disrupt bladder control signals. Enlarged prostate. In men, benign prostate enlargement squeezes the urethra, causing leaks when the bladder contracts urgently. Medical treatments, pelvic surgeries, radiation therapy, or certain medications can damage incontinence mechanisms temporarily or permanently. Incontinence affects more than hygiene and skin health. It also causes embarrassment, anxiety, and social isolation. Many hide their leaks, cut back on outings, and limit physical activity for fear of a public accident. What you can do at home: Kegel exercises. Squeeze your pelvic floor muscles as if stopping urine flow. Hold 10 seconds, then relax 10 seconds. Do 3 sets of 10 daily. Bladder training. Gradually lengthen the time between bathroom visits. If you go every hour, try waiting 65 minutes for a few days to build capacity. Fluid control. Limit coffee, tea, and alcohol, which irritate the bladder. Sip water steadily throughout the day. Maintain healthy weight. Each extra kilogram adds pressure to your bladder and pelvic floor. A fit body reduces stress incontinence. See a doctor if leakage is constant and interferes with daily life. If you have blood or pain when peeing along with leaks, if urgency is so severe you can't make it to the toilet, or if home exercises don't improve things after several weeks, a urologist or pelvic floor physiotherapist can offer additional treatments, from biofeedback devices to medications, and in selected cases, minimally invasive surgery. Remember, incontinence is not an inevitable part of getting older. With early diagnosis and the right exercise and habits, many people regain control and confidence. Don't suffer in silence. Detecting and treating incontinence improves both your physical health and emotional well-being. Feeling like your bladder never fully empties is a red flag you shouldn't ignore. That constant half-full sensation causes ongoing discomfort and can lead to serious complications if left untreated. You may notice persistent pressure in your lower abdomen after peeing, as if your bladder is still full. You might feel urgency, but only a weak stream or a few drops come out. This indicates partial urinary retention. Your bladder isn't emptying completely. Dangers of prolonged retention include recurrent infections. Stagnant urine is a breeding ground for bacteria. One ignored infection can travel up to your kidneys, causing pyelonephritis with high fever, back pain, and risk of sepsis. Kidney damage. Ongoing pressure in the bladder can back up into your ureters and kidneys, harming the tiny vessels that filter your blood. Chronic retention can reduce filtration and lead to kidney failure. Risk of acute emergency. Sudden total retention, when you can't pee at all, is an emergency that causes intense pain and requires immediate catheterization to prevent permanent damage to your bladder and kidneys. Common causes are medications. Anticholinergics, opioid painkillers, or antihistamines can overly relax your bladder or constrict your prostate, blocking flow. Physical obstructions, enlarged prostate, bladder tumors, or stones at the bladder outlet can partially or completely block urine. Neurological issues, spinal injuries, advanced diabetes, or Parkinson's disease disrupt the nerve signals that tell your bladder when to contract or relax. Muscle weakness, a pelvic floor weakened by prior surgeries or radiation loses strength to empty the bladder. How to detect it? Symptom log. Note how often you try to pee, the approximate amount, and whether you still feel pressure. Post-void residual measurement, using a handheld ultrasound or office scan. Your doctor measures how many milliliters remain after peeing. More than 50 milliliters is abnormal. Urodynamic tests. Assess bladder and urethral function by measuring pressure and flow to find blockages or dysfunction. Urinalysis and prostate exam. Check for infection, hidden blood, and evaluate prostate size via rectal exam or transrectal ultrasound in men. What to do if you suspect urinary retention? Don't wait for discomfort to pass on its own. Schedule an appointment with a urologist or nephrologist for the necessary tests. Review your medications with your doctor to consider changes or dosage adjustments. Stay well hydrated, but avoid drinking large amounts of fluid at once. Empty your bladder slowly and calmly. Untreated urinary retention can go unnoticed until kidney damage is irreversible. Preventing and diagnosing it early lets you preserve healthy urinary and kidney function and avoid complications that would disrupt your quality of life. So far, we've covered 7 signs you should never ignore when you urinate. But your body doesn't always send just one warning. Sometimes it combines multiple symptoms to alert you to a more serious issue. Recognizing these dangerous combinations is key to acting quickly and without panic. When 2 or more signs appear together, pain or burning plus blood in the urine suggests severe inflammation or internal injury. It might be an advanced infection, harming tissues, or large stones consistently scraping the lining. Persistent foam plus sweet or fruity odor implies chronic kidney disease plus a metabolic imbalance like diabetes. These conditions feed one another and accelerate kidney damage. Frequent urgency plus involuntary leakage points to an overactive bladder or a severely weakened pelvic floor, increasing infection risk from constant dribbling and nighttime leaks disrupting sleep. Retained urine plus very concentrated dark urine combines toxin buildup with back pressure on the kidneys. This can lead to acute failure if the bladder isn't emptied in time. How to heed your body's warnings without panic? Stay calm. Noticing multiple symptoms doesn't mean the worst diagnosis, just a call to action. Fear paralyzes, information empowers. Log each signal. Record date, time, symptom, and any related factors: food, exertion, medication. A urinary diary helps you spot patterns and share concrete data with your doctor. Photograph unusual changes. If you see odd colors, red, brown, foam, take a picture in a clear cup. This avoids forgetting details and shows persistence of the symptom. Note your fluid intake. Track how much water, coffee, alcohol, and other drinks you consume each day. This helps distinguish true problems from dietary effects. What to tell your doctor? When you book your appointment, be ready to describe symptoms precisely. I've had burning when I pee for the past 3 days, pain level 6 out of 10. My urine has been very foamy each time I go, and the foam lasts more than 30 seconds. I feel such an urgent need I sometimes can't make it. Plus I leak a bit when I cough. Last night I tried to pee 3 times and still felt full, then noticed the urine was darker than usual. These concrete details help your doctor prioritize tests: urinalysis, ultrasound, kidney function tests, or urodynamics. Act quickly. 2 or more combined signs. Request an appointment within the next 24 to 48 hours. Acute symptoms: severe pain, total retention, fever. Go to the emergency department. While some symptoms require professional care, you can adopt daily habits to improve urinary and kidney health before seeing a specialist. These measures don't replace a professional diagnosis, but can relieve discomfort and prevent complications. Balanced diet. Reduce salt. Excess sodium causes fluid retention and raises blood pressure, harming the kidneys. Use herbs and spices instead. Increase fresh fruits and vegetables. They provide water, vitamins, and antioxidants that protect kidney cells. Melon, cucumber, and watermelon are especially hydrating. Control animal protein. Too much red meat and processed meats increase kidney workload. Choose fish, legumes, and eggs in moderation. Limit bladder irritants. Cut back on coffee, strong tea, alcohol, soda, and citrus if you have urgency or incontinence. Proper hydration. Drink 1.5 to 2 liters of water a day to dilute urine, flush toxins, and prevent crystals and bacteria. Sip throughout the day and reduce fluids 2 hours before bedtime to avoid nighttime bathroom trips. Pelvic floor exercises. A strong pelvic floor improves bladder control and reduces leaks. Try this routine. Identify the right muscles. Stop your urine midstream. Those are the ones to train. Sustained squeeze. Tighten for 5 seconds. Relax for 5. Repeat 10 times. Quick squeezes. Contract rapidly for 1 second, 20 times. Frequency. Do both routines 3 times daily, ideally seated or lying down. Regular checkups. Even without pain, an annual urine test and blood pressure check can catch early issues. If you have risk factors, diabetes, hypertension, or a family history of kidney disease, get tested every 6 months. What you can do at home before seeing a specialist: keep detailed logs of symptoms, urine amounts, and any unusual color or odor. Photograph samples if you notice blood or persistent foam. Review your medications with your primary care doctor to spot any that might cause retention or irritate your bladder. Maintain a healthy weight. Extra kilos increase pressure on your bladder and raise blood pressure. Habits that quietly harm your bladder and kidneys. Regularly delaying urination weakens bladder muscles and promotes infections. Overusing painkillers, high doses of acetaminophen or NSAIDs can cause silent kidney damage. Smoking. The toxins in tobacco damage kidney circulation and raise bladder cancer risk. Sedentary lifestyle. Lack of exercise worsens circulation and kidney filtration. Incorporating these changes gradually will help keep your urinary tract healthier and reduce the occurrence or severity of the symptoms we've discussed. Remember, every time you notice something unusual while urinating, your body is sending you a message. Listen and act. Your long-term well-being depends on it. Your urine is one of the clearest messages your body sends every day. Yet too many people ignore those signals out of embarrassment or because they believe it's just age. They forget that spotting a problem early can mean the difference between a simple treatment and serious complications. It's better to see a doctor for a false alarm than to wait and find out too late. This phrase captures the essence of caring for your health. You can never be too cautious. I met Don Alberto, 76, and retired from a furniture factory. He noticed slight burning when he urinated and persistent foam, but didn't connect it to anything specific. He thought more water would fix it. When it didn't improve, and he remembered this video, he booked an appointment. A test revealed mild proteinuria and a urinary infection. Thanks to early diagnosis and treatment with antibiotics and pelvic floor exercises, he avoided progression to chronic kidney disease. Today, he walks confidently, does his exercises, and attends regular checkups. Every time you urinate, your body communicates with you. Sometimes it's a whisper, a subtle color change, an unusual smell. Sometimes it's a shout, intense pain, uncontrollable urgency. Paying attention to those signals is an act of self-care. Imagine celebrating many more birthdays, enjoying your grandchildren, and traveling without the constant fear of an avoidable complication. Living longer only matters if those years are filled with health and quality of life. You deserve to know what's happening inside you and to act swiftly. Don't ignore the signs when you urinate. If something seems off, seek medical help, bring your records, and ask questions without fear. Caring for your urinary and kidney health is caring for your future, because living a long life truly matters only when you live it fully and peacefully. Are you ready to take control of your health starting today? Tomorrow may be too late. If you enjoyed this video, don't forget to like, subscribe, and hit the bell so you don't miss the next one. Thank you for watching.